Did you know, with early diagnosis and treatment, most HIV-positive people will never get AIDS and will have a typical life expectancy? Awesome, right? The human body is a marvel. Central to this system is our immune system, a powerful defense force that protects us from harmful invaders like viruses and bacteria. However, there are certain foes that pose a significant threat to our immune system, and one such adversary is HIV. HIV stands for Human Immunodeficiency Virus. This virus targets a particular type of white blood cells called CD4 cells, or T cells. These cells are vital players in our immune response. HIV invades these CD4 cells, hijacking their machinery to make copies of itself. These copies then go on to infect more CD4 cells, leading to a gradual decline in their numbers. As HIV multiplies, it weakens the body's ability to fight off infections, leaving the individual vulnerable to a range of opportunistic illnesses. Without treatment, HIV can progress to a more serious stage called AIDS, or Acquired Immunodeficiency Syndrome. AIDS is characterized by a severely damaged immune system, leaving the body susceptible to life-threatening infections and cancers. Understanding how HIV is transmitted and the various methods of prevention is the first step towards protecting ourselves and others. This is where education and awareness come into play. Educational programs play a crucial role in dispelling myths and misconceptions surrounding HIV. They provide accurate information about how the virus is spread, which is essential for reducing fear and promoting responsible behavior. Alongside education, regular HIV testing is paramount. Early detection of HIV is crucial for several reasons. Firstly, it allows individuals to access treatment early, which can significantly slow down the progression of the virus. Secondly, early diagnosis allows individuals to make informed decisions about their sexual health, reducing the risk of transmission to others. Testing itself is a simple process. It can involve a blood test or even a rapid test using oral fluids. These tests are readily available at healthcare providers' offices, clinics, and even some community centers. By embracing both education and regular testing, we equip ourselves with the knowledge and tools to make informed decisions about our health and effectively combat the spread of HIV. In the fight against HIV, we have a range of preventative measures at our disposal. Among these, condoms stand as a cornerstone of HIV prevention. When used correctly and consistently, condoms provide a highly effective barrier against the sexual transmission of HIV. They work by preventing the exchange of bodily fluids, the very carriers of the virus. Condoms are readily available, affordable, and easy to use. Furthermore, condoms offer dual protection by not only preventing HIV transmission, but also reducing the risk of other sexually transmitted infections, or STIs. Having any other STI hugely increases HIV risk. For those at higher risk of HIV infection, such as individuals with partners who are HIV positive, pre-exposure prophylaxis or PrEP offers another layer of protection. PrEP involves taking a daily medication that significantly reduces the risk of acquiring HIV. It acts by preventing the virus from establishing itself in the body, even if exposure occurs. PrEP is a highly effective prevention method, but it's important to note that it's most effective when taken consistently. In situations where potential exposure to HIV has already occurred, post-exposure prophylaxis, or PEP, provides a crucial window of opportunity to prevent infection. PEP consists of anti-HIV medications taken for 28 days after potential exposure. It's most effective when started within 72 hours of exposure. If you think you've been exposed to HIV, seeking immediate medical attention is crucial to discuss the possibility of starting PEP. Harm reduction programs play a vital role in minimizing the negative consequences associated with certain behaviors that can increase HIV risk, particularly among people who inject drugs. One of the most effective harm reduction strategies is needle and syringe exchange programs. These programs provide sterile needles and syringes to people who inject drugs, reducing the risk of HIV transmission through shared needles. By providing clean equipment, these programs not only reduce HIV transmission, but also offer opportunities for health education, counseling, and referrals to other essential services like drug treatment programs. Another important aspect of harm reduction is addressing the underlying factors that contribute to drug use and risky behaviors. This includes providing access to mental health services, addressing housing instability, and promoting social support networks. These programs are essential components of a comprehensive HIV prevention strategy, ensuring that we reach all segments of society and leave no one behind in the fight against this virus. Treatment as prevention. The concept of treatment as prevention is a game changer in the fight against HIV. While there is no cure for HIV, the treatment reduces the amount of the virus in the body. There are two types of HIV treatment. These are pills and shots. We will discuss the difference and indications further in the upcoming videos. When people living with HIV adhere to antiretroviral therapy, or ART, the amount of virus in their blood can become undetectable. This not only helps them stay healthy but also prevents the transmission of HIV to others. Remember, undetectable equals untransmittable. People cannot pass on HIV sexually if they are on effective treatment. Please underline the word effective. Research has shown that people with an undetectable viral load have effectively no risk of sexually transmitting the virus to their HIV-negative partners. This approach underscores the importance of regular HIV testing and early initiation of ART. By ensuring that people living with HIV have access to effective treatment and support, we can dramatically reduce new infections and improve the quality of life for those affected. Treatment as prevention is a powerful tool in our efforts to end the HIV epidemic. For many people living with HIV, access to comprehensive care and support services is a lifeline that extends beyond medical treatment. Holistic care addresses the physical, emotional, and social aspects of living with HIV, fostering a sense of hope and well-being. Access to stable housing, employment opportunities, and legal assistance are also vital components of comprehensive care. Stigma and discrimination remain significant barriers for people living with HIV. Creating a supportive environment is crucial to ensuring that individuals feel safe and respected, and can access the care and services they need without fear of judgment. Education and awareness campaigns play a key role in challenging misconceptions and reducing stigma. By promoting accurate information about HIV and fostering empathy and understanding, we can create a more inclusive and supportive society. Workplaces, schools, and healthcare settings must also adopt policies that protect the rights of people living with HIV and promote a culture of respect and inclusion. By working together to create a supportive environment, we can help people living with HIV thrive and lead dignified lives. Know your status, get tested, get treated, end HIV transmission. Happy World International AIDS Day.